Kind of keep it going with the real world and talk about some of the tools that you can use to help support implementations, how to actually do some of this in practice. There's a lot of tools and resources to support. Yeah, so the first tool that I'm going to talk about is one that we developed here at the Knowledge Translation Program. This is something that was led by Tina and a number of other staff in our program. And this is a workbook that's designed to take you through that action cycle portion of the knowledge to action cycle. So the workbook has 5 main steps. So it wants to take you through identifying your what, identifying your who, help you understand why people will or will not do what you want them to, identify what strategies you can use for your implementation, and then help you plan for how you can evaluate and sustain. So this is a whole workbook. It's published open access and you can access it online. And we're also going to provide it, and Walter and team will post it on the HSPM website for you as well, so you can grab it easily there. If we can go to the next slide, I'll show you, this is one of my favorite figures from this workbook. And it shows you kind of all of the different, well, not all, some of, because there are many, but some of our favorite tools for doing implementation and working on these different steps of the action cycle. So, for example, you can see when we're trying to figure out why would somebody change our practice, we might use the COM-B, which Tina talked about, or we might use a couple other frameworks. So the theoretical domains framework maps well with the COM-B and can help you identify implementation strategies. Or Marjorie mentioned for FI Block, they use the Consolidated Framework for Implementation Research, the CFIR. That's a framework that can also help you identify implementation strategies. And that framework also has quite a few associated tools that the developers of the CFIR post on their website for developing things like interview guides and surveys to help you gather information about your why. So these are some of the frameworks we like to use. You can see we've identified frameworks and resources for many of the steps throughout the cycle. And so those are things that you can reach for and that the workbook can help you find. One of the resources that we've included in this workbook is something called the Select tool. And so this is a tool that helps you take your barriers and you map them to that TDF I was speaking about. So that TDF has different domains related to behavior. So we can take a barrier and we can say, what TDF domain does this barrier describe? So if we're thinking about Tina's moves example, somebody said, it's not my job to move patients. That's what physiotherapists do. We can look at the TDF and say, okay, that barrier probably belongs to the domain of social therapeutical role. So they don't feel it's part of their role to do this thing. And then when we've mapped things to the TDF domain, through the COM-B and something called the behavior change wheel, we can map those barriers to what we call intervention functions. So those are categories of implementation strategies. So we know, for example, you can see here that social professional role and identity maps well to implementation strategies under education, persuasion, and modeling functions. Tool. So once we've identified what intervention functions might be useful, we can then pick what implementation strategies might work well. So we knew that for addressing our barrier of it's not my job to move patients, education could be a useful intervention function. And then when we look at this table, we can see we have a couple of options for what might work best for education for implementation strategies. So we could conduct educational meetings, or we could distribute educational materials. So we've been able to tell what might work best, and now we have a list of strategies that we can pick from this tool to help us with our implementation. So then we have other tools that we can use to help us prioritize and pick which strategies we might decide to move forward with. So a couple things that we like to think about first before we even jump into these tools: what strategies are going to address a really large number of our barriers? So like Marjorie said, one of the very first things they did was make sure that they had a process together for the clinical environment. So that addressed 10 of their barriers, which was the most of any of the other strategies that were potentially useful. So that was a good one to prioritize to do first, because it was going to address a lot of barriers. And then the other thing we always look at is, are there any barriers that we need to address? Because if we don't address this barrier, nothing is going to change. So for example, say we had a barrier that was that we don't have access to the supplies to do this practice. So even if we have another barrier that's, oh, we don't really know how to do it, it's not really going to matter if we spend a lot of time educating and training people, because we didn't give them access to the materials, so they're not going to be able to do the practice. So we'll also look and make sure we've addressed any of those barriers. So we call them hard stop barriers, that no matter what else we do, we're going to prevent people from being able to do the practice if we don't address that. But once we looked at those two things, we might still say, okay, we still have a lot of options for implementation strategies, and we're not really sure, which one should we decide to address. And so we want to work with our knowledge users. So it might be patients or clinicians, because they might help us pick which ones are going to work best. But then we can also use these criteria. They're called the APPEASE criteria. So we want to look at, is the strategy going to be affordable do we have enough money to make it happen, enough resources to make it happen? Is it going to be practical, or is it going to be really difficult to do in your setting? Is it going to be effective when we're looking at what our options are? Which of our strategies have the most evidence to say this is going to be highly effective? For example, we know like printed material education can work, but its effect size is maybe only 2 to 3% versus some other strategies have a much larger effect size. So we might want to consider some of those more effective ones first. Is the strategy going to be acceptable for our population? Maybe your population really hates printed educational materials. If you give them printed educational materials, it's not going to be acceptable to a population and they're not going to use it. Then you want to consider, are there any side effects or safety concerns with your strategy? And are there any equity considerations that you want to make in helping you pick which strategies? So I really like these criteria for helping you with that prioritization process. And of course, you're going to want to look to your knowledge users and partners as well to help you pick which strategies are going to be best for your population. And last tool that I'm going to make a plug for today, one of the important things, I think Tina's touched on it, Marjorie's touched on it, it's also important to consider intersectionality in all of your implementation work. So that's considering both in your population, what intersectional factors might exist that could affect implementation, but also on your implementation team, what intersectional factors does your team have that might affect the work that you're doing as well. And our team here at the Knowledge Translation Program has developed a number of resources to help you consider intersectionality as a part of your projects. We have a few workbooks that we're going to include in that resource package that we're going to send along. But this is one of them. So this is our reflection workbook. So this takes you through thinking through intersectionality as a part of an implementation project and helps you as an implementer, an implementation team, reflect on intersectionality and how your intersectional factors could impact your project, and also how you can think about intersectionality of your populations. And then there's also a number of other workbooks that help you think through intersectionality at like particular steps in that action cycle as well. And we've included those in the resource package that we're going to send along. And last slide, I'll just say, when people are thinking about developing their implementation teams, you don't want an implementation team to be too big. The bigger it is, the harder it is to get things done sometimes. But generally, we say implementation teams should be about 3 to 5 people. And between those people, you want to look for people that have some of these specific things that I put here on the slide. So you want to look for somebody that knows the clinical intervention you're trying to put in, and somebody that knows the KT intervention that can help you promote those core components. You want somebody who knows and can apply implementation science methods to your project. You want to look for people that can help promote and participate in systems change. They can work at multiple levels of the system. That's an awesome person to have. And you want somebody who knows about and can apply monitoring and evaluation things, can help use data to determine how things are going and what you might need to adjust. And so you might have somebody that has multiple of these things. You're probably not going to find all of this in one person. Maybe you will, but it's most likely not. But if you can find a few people with a few of these different things, that can put together a really strong implementation team for you. I'll just make a quick plug here as well. If you're interested in learning more about some of these topics, we do offer a couple of courses that go kind of deeper into some of these topics. So we offer a Foundations of Knowledge Translation course online. This gives you some of the basics of knowledge translation, like KT definitions, some of those main theories, models, and frameworks that get used. And this one is online. You can take anytime. We also offer a course, we call it the Practicing Knowledge Translation course. It's 4 or 5 days, and it goes into detail about all of the things we talked about today. It gives you a lot more examples and hands-on practice. And the idea of the course is at the end of the course, people have come in with a project that they want to implement, and they walk away with a action plan that they can use to go out and start implementing. And so if you're interested in either of these, I know the slides are going to get passed along. So there's a QR code there that you can use to go to our website to get more information about the courses that we offer.